Hormone replacement therapy is not one size fits all. People are so unique, their blood tests are so unique, and they have different needs. My name's Dr. Gabrielle Francis, and welcome to my series, Empowered Menopause. On this episode, we're going to talk about the different strategies of hormone replacement therapy from perimenopause to menopause and beyond. Let's get to it. HRT, or hormone replacement therapy, is used differently at different times of the perimenopause-menopause spectrum. If you're in perimenopause, the hormone replacement therapy should be keeping you in that balance of estrogen from day 1 to 14 at higher levels, and it continues on throughout the entire cycle, and then progesterone only in the second level of your cycle from day 14 to 28. So the goal during perimenopause is to keep your hormones in that 28-day cycle extended through the full cycle, where it's estrogen and progesterone in their natural rhythm. Once a woman's moved fully into menopause, the FSH is high and the estrogen and progesterone are the same throughout the entire cycle, and they're about 20% of what they were before. So if a woman's in menopause, the estrogen and progesterone should be the same throughout the entire cycle. Every day should be the same. And she should also be getting her ovary and her uterus monitored with a pelvic ultrasound to make sure there's no lining that's growing, make sure there's no cancer or ovarian cancer. And she should also be getting yearly ultrasounds of the breast and yearly mammograms, because even though most bioidentical hormones can't cause cancer, if you have cancer, they can feed it. So there's a different strategy in perimenopause than there are in menopause, and the best way to navigate which one is for you is by working with your doctor and getting hormone tests yearly.